Namaste, dear friends. Today, I want to talk to you about the lumbar and the sacral spine, the sacral area of the body. So, I have a model here. It is a model of last three lumbar vertebrae and the sacrum. You can see that how the spinal cord, this is the spinal cord. The yellow structure here is the spinal cord. Let me get the vertebra out for you. This is the spinal cord. And this is how the spinal cord that comes straight down from the brain goes through the vertebral column. These are the vertebrae, and they make a column, and that's called the vertebral column. And the spinal cord, which is you can say the communication line of our body, goes through this area. Between the vertebral structures, vertebral bodies, we have an intervertebral disc. This is a very, very crucial part of our body, especially to absorb shocks. Now, if you remember that the lower vertebrae, like the lumbar vertebrae, are much thicker because they take a lot of load from both ends, from above and from below. That's why there's a lot of chance that the intervertebral discs like these might get damaged. If the biomechanics, if the muscles are not strong enough. And that's why we all need to do some exercise to maintain the muscle health and the bone health. Especially when it comes to yoga, asana practice, I see a huge trend amongst modern yogis to do a lot of back bends. And we have to be very, very careful when we do back bends. That's because this angle, the L5 and S1 angle, lumbar 5 vertebra and sacral first vertebra, this angle is very, very crucial. Through this angle, the forward rotation of pelvis and the backward rotation of pelvis happens, the anterior pelvic tilt and the posterior pelvic tilt. Now, if your lumbar spine is curved a lot or too much in the front, which is called excessive lumbar lordosis, if the lumbar spine is curved too much anteriorly, then there is a danger of this lumbar vertebra, L5, to slip off over the S1 and cause a lot of damage. Usually, the angle at which the lumbar and the sacral vertebra are present in the body is around 22 degrees. But many times, because of tight muscles around this area, one of the primary muscles around this area that can pull the lumbar spine forward is a primary muscle of movement and a hip flexor. It's called the iliopsoas muscle. And if that iliopsoas muscle is very contracted all the times, or if you're sitting a lot, or if you're not walking properly, or if you're constantly wearing high-heeled shoes and things like that, then the chances are that this lumbar vertebra might slip forward and slide over the S1, that's the sacral one, and cause damage. One of the primary causes of lower back pain is the slipping over of the lumbar fifth vertebra over the sacral first vertebra. But there are lots of muscles around it. Universe or our biology has given us a lot of inherent protection. There are lots of ligaments, like the longitudinal ligament here, and lots of different muscles that hold these are the spinous processes, and these are the transverse processes. You can see here on the side, there are lots of muscles here, and a constant give and take and constant action of these muscles can hold the spine together properly. Not just these small muscles around the spine, but also the global muscles around it, like the transversus abdominis, which goes in front here, which is a primary stabilizer of the pelvis, and also the muscle that maintains pressure in our abdominal area. So a lot of things can be done to secure this area. The idea is to secure the lumbo-pelvic area. If the lumbo-pelvic area is secure, and you're not doing too much of flexibility practice in your asana training, then this region can be stabilized. One thing I want to mention here that in today's modern asana centric yoga, the narrative has become very flexibility centric. People go to asana class and just stretch away to glory. But overstretching can lead to a lot of damage, especially if you are obsessed with back bending and curving your lumbar spine unnecessarily. That L5 can slip over the S1. I know many yoga enthusiasts who have been bedridden because they have not taken the opportunity to strengthen their pelvic girdle area and also the abdominal area, but have gone on this unbridled pursuit of back bend and unnecessary lumbar curvature. Lordosis is creating asanas like, say, Dhanurasana or a Setubandhasan or some other strange postures that are coming up by the day, every day in today's time that we see on social media, Instagram and Facebook. So my point here is be very careful, because ultimately we have to take care of these guys. These are the nerves that go down the spine and are the main communication lines through from our brain to the lower part of the body, the lower kinetic chain, and we need to take care of them, because if anything, any uncomfortable or discomfortable things happen here in this spinal cord region, then remember there are multiple little nerves going to the organs also. So any damage of the vertebral column can also damage the communication that goes to the organs, and your whole physiology and your whole even psychology can be affected. Especially these nerves go to organs in your belly area, and any discomfortable, uncomfortable feeling in the belly area, it just puts you off for the whole day or a few days. So be very careful, especially with these intervertebral discs. They are pretty strong, but yet very vulnerable. My top suggestions would be strengthen the lumbo-pelvic girdle. Be very aware and conscious of the way you carry yourself while standing, while sitting. Number three, balance your exercises between stretching and strengthening. And number four, don't sit a lot. Don't sit for more than half an hour at a given time, anytime. It's sitting is causing a lot of damage in our today's day and age. And if we move, if we exercise, if we are aware of our body position and posture, then the ailments that come to us because of a weak lumbopelvic area can be avoided. Hope that is of some help to you. Take care of your spine, take care of your life, take care of your mind. Thank you.